The team behind Xestia are 3 international postgrad students studying entrepreneurship at the University of Strathclyde. We come from diverse educational backgrounds with working experience that has helped shape some of our ideas. Our main mission is to make healthcare easy and accessible in Nigeria. 97% of Nigeria's population is at risk for malaria. The remaining 3%, well, they live in the malaria-free highlands. With an estimated 100 million cases every year, malaria is also responsible for up to 11% of maternal mortality. As we already know, malaria is a fatal disease that kills over 300,000 Nigerians every year. It is the third leading cause of death for children under 5 years old, a statistic made even more sobering when we realize that such casualties can be prevented.
97% of the Nigerian population are at risk. 100 million cases are registered alone in Nigeria, and that is our total addressable market. 300,000 deaths occurs only in Nigeria due to malaria. We'll place 5 machines initially in urban areas of Nigeria. We assume that we can only cover 0.01% of total cases in Nigeria as per our location and services. We further assume that only 10% of that 0.01% of TAM will actually turn off for medical aid. That will account for 1,000 cases. We further sell machines to NGOs to cover rural areas as well to make business more sustainable and profitable.
Currently, the options for most Nigerians would be to go to either a government hospital or a private hospital. The former is infamous for its long lines and unreliable doctors, while private hospitals are known for their expensive fees. It's clear that Nigeria needs an innovative middle ground solution, and this is where Xestia comes in. As a company, we intend to enter the Nigerian market by mid-2018, installing approximately 5 machines in the urban areas of Nigeria, starting with the capital Abuja, and then spreading to other cities like Lagos when we've gained consumer confidence. Our end users are Nigerians living in both urban and suburban areas. To sustain the business in rural areas, we will sell the machine to NGOs like International Medical Corps. The financial support from external funds will keep the business sustainable, thus allowing Nigerians to have access to better health care, even in rural communities.
4 weeks ago, I was diagnosed with malaria. One of my friends told me about the new machine, which was 5 minutes away from my house. After using that machine, I'm totally amazed. My life is totally different now, and I'm fully cured from malaria, which is one of the most dangerous diseases here in Africa. This machine is one of the best equipment that the medical service can use to cure people in Africa. I'll tell you further details about the machine, how the machine works, how the investors are going to get benefit from the machine, and how we're going to work with the NGOs to make better lives for the people of Africa. Thank you, guys.
Xestia will have the following components. The first component is camera and microphone. That is important for teleconferencing. The other component is for user interface. That is touchscreen monitor. And the third component is the keyboard and input device, from where you can put your input and you can type. You can tell doctor about your diseases and communicate with the help of the keyboard and touchscreen. The machine will have cash and card acceptor, which will accept cash and payments by card. The machine will have one medicine dispenser, which will dispense both liquid and tablet medicines. The machine will have a prescription printer. The machine will have a prescription scanner. In the same place, the machine will have an ECG and heart rate monitor, and the top module will consist blood pressure monitor. And important of all, the machine will have a blood collector and testing module, which is already been in market by our health. Now we'll talk about how this machine works. What's the user interface? This is the machine welcome page. After that, you need to select your language. After selection of language, machine will opt you 3 options, which are symptom search, direct consultation, and medicine dispense. For symptom search, you could write your symptoms in the search column and then search it. Machine will try to diagnose some diseases based on your symptoms. Machine will suggest you some medicines and even give you the option for direct consultation, and will give you the option to print the prescription provided by the machine. Now we come back to the main page, where machine will opt you 3 options: symptom search, direct consultation, and medical dispense. Suppose now the patient want direct consultation. In direct consultation, the patients need to pay for the service first via cash or card and then continue. After payment being authenticated, the machine will connect to the doctor with your language preference. After that, doctor and patient will communicate with each other, and doctor will try to diagnose the diseases by asking more about symptoms. If the doctor was able to identify and diagnose the disease, doctor will provide the prescription and medicines, which the patient can either print the prescription or patient can take the medication as well from the machine. But in case if the doctor need further verification for the data, then doctor might ask patient to go for a blood test, or to go for ECG or heart rate, or to go for BP measurement. ECG, heart rate monitor, and blood pressure are all free service, but if the doctor will ask for a blood test, then it's a paid service and the customer has to pay again. For authentication of payment, the machine will give patients the direction for how to do the blood test, and when the sample was collected, the machine will send the result to doctor, and then the doctor can diagnose the disease more clearly and better. After that, again the doctor will provide prescription, and now it's up to the patient either to take the prescription, and if the patient wants, he can take the medication as well from the machine itself. And that is how the direct consultation cycle works. Now we again come to the start. This machine can act as a pharmacy as well. If the patient directly come to the machine and know the medicine's name or the component name, the patient can search the medicine in the machine, and the machine will then show the result if the medicine is available or not, and if it is available, patient can then take the medicine directly from the machine. If the patient have the prescription with them, they can directly upload the prescription in the machine, and then machine can dispense the following medicines if it is available in the machine. Both of these cases, machine are acting as a pharmacist, and this is how the machine works.
Based on market research, a medical machine will cost £3,000 to make per machine. Our total investment, not including rent or machine upkeep, will tally up to £15,000. We intend to start with 5 machines located in strategic areas in Abuja, and we expect sales to increase by 25% every year. Our competitors are Kangpi, a platform for users to get medical advice from doctors. Then there's MobiDoc, offering health consultations with doctors in real time. And finally, there are doctors working in government hospitals in Nigeria. What differentiates us from our competitors is our seamless customer journey, allowing the patient to get the medication right after a consultation, no waiting lines, and affordable medication.
In future, we'll try to make Xestia a one-stop solution to all medical needs for all Africans. We want to make Xestia to be that advanced that it will diagnose most of the diseases with its state-of-the-art technology. We'll want to make Xestia more portable in future, so that to cover most of the rural parts of Nigeria, and we'll join with more NGOs to make it more sustainable, and then we'll try to cover more parts of Africa. We basically want to make Xestia more affordable healthcare for all Africans. Thank you.